Do you have a gastrointestinal disorder, such as an ulcer? Then Prilosec, also known as omeprazole, made by AstraZeneca, is the drug for you. However, it is not the drug for you if you are allergic to omeprazole. Be sure to ask your doctor if it is safe for you to take Prilosec if you have a liver or heart disease. Seek medical help if you have any sort of allergic reaction, such as hives, difficulty breathing, swelling of the face, lips, or tongue, watery or bloody diarrhea. Side effects of Prilosec include fever, cold symptoms, stomach pain, gas, nausea, and vomiting. The drugs that may affect Prilosec are St. John's wort, Coumadin, antifungal medications, diuretics, or water pills. Prilosec is administered orally. The molecular mechanism that makes Prilosec therapeutic is the fact that it binds to an enzyme on the gastric parietal cells in the presence of acid gastric pH, preventing final transport of hydrogen ions into gastric lumen. The therapeutic effects would be that it diminishes the accumulation of acid in the gastric lumen with lessened gastroesophageal reflux and healing of the duodenal ulcers. Some people taking Prilosec may have an increased risk of bone fracture in hips, wrists, and spine. This has occurred mostly in people taking for a long term or at high doses. Also in people at the age of 50 or older. Tell a doctor first if you have bone disorders. Use the medication directed by the doctor, and be sure to read the patient instructions included with your medication. Do not change the doses of your medications or the schedule without asking your doctor. If you have watery or bloody stool, stop taking and call your doctor immediately. Be sure to avoid alcohol and medicine containing aspirin, and also foods that cause GI irritation. Doctors should assess patients for epigastric or abdominal pain and also check for blood in stools. Did you miss a dose of Prilosec? Don't worry, you can take Prilosec again unless it is close to your other treatment dose. Do not add up extra doses. Do not take extra doses to make up for missed doses. If overdose occurs, seek medical attention immediately. After oral administration, the effect occurs within 1 hour. The maximum or peak effect is 2 hours. The duration lasts 72 to 96 hours. The half-life is 30 minutes to 1 hour. Both a loading and maintenance dose may be required. A loading dose may be required if symptoms are not alleviated with first full course of medicine prescribed. Loading dose would be higher in the first round and a smaller dose prescribed for second course of treatment. A maintenance dose is required every day during course of treatment because you are continuously taking the medicine prescribed for a certain amount of days and doses. This way the medicine continues to work in your system for the allotted amount of time. Prilosec is rapidly absorbed after oral administration. Prilosec comes in delayed release capsule form, which has an enteric-coated granule, and the absorption begins when the granules leave the stomach. The plasma levels peak between 30 minutes to 3.5 hours. Does Prilosec sound like the drug of your choice? Then go to your doctor today to get your prescribed medication, or go to your local drugstore for your over-the-counter bottle of Prilosec.